Okay, you've mentioned a prostatectomy. Tell us what happens with a prostatectomy and how physio can help with that.
So with a prostatectomy, your prostate is removed, and there are important structures that are attached to your prostate that are also removed. These structures play a very important role in your continence or to prevent your incontinence. So what typically happens is you get your prostate removed and then there's a catheter inserted, and a part of your urethra, which is the structure that goes from your bladder through your prostate, through your penis, and that's the vessel how you eliminate urine out of your body. A part of that gets removed as well as it attaches into the bladder and the prostate. And then you're basically sticking two pieces of the urethra together with a catheter in between, and you stitch around it. So that's why you have your catheter in for 7 to 10 days to protect that stitching. So when they do the surgery, even though if it's a robotic surgery, it doesn't have to be a robotic surgery, you still have instruments in your pelvis. There's stretching, there's cutting, there's moving of organs, there's moving of muscles. You have to think of it like any other operation. So many of you might know someone who's had a knee replacement or a shoulder replacement or a shoulder operation, and you're out of the hospital in a sling or a brace. It's not like you just jump up and down and get going. And because the base of the pelvis is muscular, and it's called the pelvic floor muscles, it's a group of muscles together, they basically get traumatized during surgery. Doesn't matter if it's robotic surgery or not, you still have those arms coming into the abdomen and you remove a prostate out of it. So your muscles go into a coma. They have been battered and bruised. They need time to recover. So you've got sore muscles, you've got bruised muscles, you've now removed the prostate out, and now the bladder, which used to be right above the prostate, now sits on your pelvic floor. And I can remind you, the pelvic floor has already been traumatized, it's already sore, it's already bruised, it's been stretched, it's been heated up, and that's just the muscles. I haven't even started with the nerves. So then the bladder sits on top of that. And now we say to you, 7 days, you get 7 days of rest, and then let's go, and you must be continent again. And that's the main thing. Think of any orthopedic operation. You don't have your knee replaced and do the comrades the next week. It takes weeks, maybe months to get back to that period of time. The major issue and the major problem with the pelvic floor is we cannot see it. It's inside our pelvis. You cannot see it. You can't see a scar on the inside. You can see your port scars from the robotic arms, but you can't see inside your pelvis. So you don't know if it's better, if it's bruised, if it's this or that. So it's a very confusing time because you've got all these symptoms and you can't connect your brain to what's going on inside. But without the prostate now, things change, things shift, things need to adjust, and there are obvious changes related to that. And from the point of what happens outside of the pelvis, as I mentioned to you, that a part of that urethra is removed. Okay, so it's very common for men to find that they have a shortening of their penile length for a period of time because you've cut out a little piece of the urethra and pulled it back in, and for various other reasons, you have some physical symptoms. And then the major thing that I touched on just now is the nerves and what happens to the nerves. We've spoken about the muscles, and the muscles have, they get beaten up quite brutally, and then we get them to recover. But nerves are also in there. So everywhere where there's a muscle, there's a group of nerves. And there's a lot of nerves in the pelvis, and some of them have specific roles to play in pain and dysfunction. And then we have a group of nerves that are specifically responsible for allowing you to have an erection. And those nerves sit right around the prostate. And this is where the surgeon and the surgical skill is so important, because they go and remove the prostate without trying to damage the nerves. And that's the gold standard. You want to remove the prostate without damaging the nerves. But of course, the nerves have been stretched, they've been heated up, they've been pulled, so they also go into a coma. So one of the consequences is erectile dysfunction, And that takes a bit of time to settle down. And what happens when you don't have penile tissue that has the ability to have an erection X amount of times a day, it's the same thing as having a shoulder that you stop moving. If you stop moving your shoulder, it's going to get stiff. It's not going to work properly. Your penis is the same. If you don't achieve an erection multiple times a day, and by the way, a normal male should have 7 to 9 erections in your sleep. That's a normal thing. That's a physiological thing, and that's to help maintain the tissues, the tissue length and tissue dexterity. Now you're missing that. You don't have your ability to have your erections when you sleep, which happens normally, which should happen, which is normal. You can't have an erection when you want it. So there are physical consequences due to that. And our role is to try and minimize that and to try and address those as soon as possible.
Very interesting. Thank you, Pierre. We'll be back next time with some more information.
Thank you so much.